Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of community medicine or PSM on the topic biostatistics and epidemiology, and the subtopic will be incidence versus prevalence. So let's start.
Welcome to the examination. Today we'll discuss incidence versus prevalence. To start, can you describe the basic principles and uses of descriptive epidemiology? This information is not medical advice or diagnosis. Always see a healthcare professional or seek care.
Epidemiology or measures of disease frequency in public health medicine allows us to quantify how often diseases occur, their burden, and the effectiveness of health interventions.
That's a good overview of epidemiology generally. Specifically regarding descriptive epidemiology, what are the key features or questions it aims to address, often referred to as the who, where, when?
Mainly it talks about incidence and prevalence, attack rate, sensitivity versus specificity, and predictive values, the positive predictive value and the negative predictive values.
You've listed some very important measures in epidemiology and biostatistics. However, descriptive epidemiology focuses primarily on describing the distribution of health outcomes rather than calculating sensitivity, specificity, or predictive values, which are more related to screening tests and analytical epidemiology. Can you tell me what the difference between incidence and prevalence is?
Incidence refers to the new cases, the number of new cases of a disease that develop in a population at risk during a specified period. Whereas prevalence is the total number of cases, total number of existing cases, which is old and new in a population at a specific point in time or over a period.
Excellent, that's the exact distinction. Now, when would you prefer to use incidence versus prevalence when you're measuring a health outcome? For example, to assess the impact of a new prevention program?
The incidence is calculated to identify the etiology, the causes, and monitoring the speed of spread, whereas prevalence is used to plan for healthcare resources.
Exactly. Incidence is useful for understanding the risk of contracting a disease and its causes, while prevalence helps with managing resources for existing cases. Let's shift gears a bit. Discuss a scenario where a screening test is applied. How would you define the positive predictive value of that test?
Positive predictive value is the probability that a person has the disease given a positive test result.
Yes, that's correct. Now, what factors primarily influence the positive predictive value of a test, potentially making it lower in a population where the prevalence of the disease is low?
I don't know, can you explain please?
The positive predictive value is heavily influenced by the prevalence of the disease. If a disease is rare, even with a good test, a positive result could still more often be a false positive. Whereas in a population with high prevalence, a positive result is much more likely to represent a true case. Now, what do you understand by the terms sensitivity and specificity of a test?
The term sensitivity, which is the true positive rate, is the ability of a test to correctly identify those with the disease. But specificity, which is the true negative rate, is the ability of a test to correctly identify those without the disease.
Precisely. Sensitivity ensures that you detect most cases, and specificity prevents falsely labeling healthy individuals as sick. Moving on to basic statistical measures, what is the mean, median, and mode? When would you choose to report one over the others in a set of data?
I don't know this one. Can you please explain?
The mean is the average of a set of numbers, calculated by adding them up and dividing by the number of values. The median is the middle value when the data is ordered from least to greatest, and the mode is the number that appears most frequently. You might choose the median when there are extreme values that would pull the average too much, while the mode is useful for categorical data. Now, what is meant by the term standard deviation?